Hello everyone, this is Dr. Prashanth and welcome back to my public health series. So in this video, I'll be briefly talking about health economics and financing. So to start with the definition, it is an applied field of study that allows for the systematic and rigorous examination of the problems faced in promoting health for all. So it is used to promote healthy lifestyles and positive health outcomes through the study of healthcare providers, hospitals and clinics, managed care and public health promotion activities. So now let's understand the WHO's approach to health financing, which basically has three core functions. First is the revenue raising, that is through different sources of funds, which include government budgets, insurance schemes, and the out-of-pocket expenditure. Second is a pooling of funds, where the accumulation of prepaid funds on behalf of some or all of the population is done. And the last core function is the purchasing of services, that is the payment or allocation of resources to health service providers. Health financing is a core function of health systems that can enable progress towards universal health coverage by improving effective service coverage and financial protection. A carefully designed and implemented health financing policies can help to address many issues. For example, sufficient and timely disbursement of funds to healthcare providers can help to ensure adequate staffing and medicines to treat patients. Now let's look at the difference between the micro and macroeconomics. As the name suggests, microeconomics focus on choices and decision making process of an individual unit, that is a household or a firm. A simple example, a study of hospital cost. So in this case, the decision making power or the decision making unit is the hospital. Whereas macroeconomics is the study of broad aggregates such as total employment, national income and inflation. An example is analysis of state expenditure on healthcare. Now coming to economic agents, these are nothing but the decision-making units. So these economic agents can take economic decisions independently. And these are broadly classified into three groups. One is consumer, second is producer, and third is the government. So let's understand these three with some simple examples. First is a consumer, that is nothing but the household, can independently decide whether it would seek medical care to cure a particular disease. Whereas a producer, that is nothing but the provider of medical care, which include doctors or hospitals, they decide on how they would provide the service to the consumer, right? And the last is a government, and the government decide to intervene by imposing price control on the provider, that is nothing but the doctor or hospital, or by establishing a parallel system of healthcare provision. So the interaction between these economic agents, that is the consumer, producer and the government, forms the basis of an economic system. And the consumers and the producers interact to each other in a setup called market. So every market has two forces, demand and supply, and these two forces operate against each other. So basically, we all know that consumer demands goods and services. So these consumers demand goods and services in the output market. So we call that market as output market. So producers supply these goods and services to the consumer. Just imagine these producers also need some resources, right, to produce these goods so that they can supply to the consumers. So they get these resources from a different market that is called input or factor market. So there are two markets, output and input market. Output market is nothing but the where the consumer demands goods and services. But in the input market, what happens is the consumer plays a reverse role in input market. That means they own the productive resources so that they play the supplier role in the market. So which market? That is the input or factor market. So in output market, consumer demands goods and services. But in the input or factor market, the consumer acts as a supplier. A simple example, consumer or members of the household not only demand food, that is they're demanding food in the output market, but also work somewhere, right? They might be working in some factory, that is nothing but the supply of labor to the producers to earn the food. Okay, so this is a very simple example. Always remember, a consumer will have a reverse role in the input market. So this circular relationship between the consumer and the producer is the basis of the economic system. Now coming to the next topic, that is demand and supply curves. First we will start with the demand curve. So basically demand is the quantity of a good buyers wish to purchase at each conceivable price. It is clear, right? So this quantity of the good that people will buy depends on the price. So if the price is high, we will tend to buy it less, and if the price is low, more units will be demanded from the people. So this relationship between the price and quantity is called the demand schedule, or when translated into mathematically, we call it as demand curve. So simple example, demand schedule for luxury rooms in a hospital. So there are two columns. First is the price and second is the quantity. So that is price per room per night, that is P. And in the next column, we can see the quantity of rooms demanded, that is Q. So this is the demand curve for luxury hospital rooms. So on the y-axis, you can see the price per room per night. So starting from 500 to 4,500. And on the x-axis, you can see the quantity, that is the quantity of rooms demanded by the people. So with increase in price, that is, see, at 4,000 rupees per night, the number of rooms demanded is only 1, but at 2,000 rupees you can see the number of rooms demanded is 6. So that means by lowering the price p, the hospital could increase sales of more than 6 rooms per night. So that means q and p are inversely related. So we call this as law of downward sloping demand. So let's understand the reasons for this inverse relationship. Okay. So first is the substitution effect. So what does it mean? The term itself explains that if the hospital luxury rooms becomes costlier, some people may switch to general ward, right, because of the high prices of the luxury room. So thereby causing a drop in demand for luxury rooms. And next is the income effect. So what happens if the cost of any commodity or service is too high, or in this case, if the hospital luxury rooms are more expensive, people will feel themselves poorer than before and will try to curb their consumption of luxury rooms. So it is very clear, right? Now coming to supply curve, which is similar to that of demand curve, but in this case, we will see it from the point of view of supplier. Supply means the quantity of a good that businesses are willing to produce and sell at each conceivable price. So here we relate the quantity supplied of a good to its market price. So we will keep all the other factors constant, such as costs of production, the prices of substitute goods, and the organization of the market. So like demand schedule, here we have the supply schedule. It shows the relationship between the market price of a commodity and the amount that producers are willing to produce and sell. So let's understand this with the same example, that is supply schedule for luxury rooms in a hospital. So the first column remains the same, that is the price per room per night. So it is 4,000 to 1,000. And in the second column, we can see some change, right? So here we are not taking the quantity demanded by the patients. Okay. Here the quantity of rooms hospital will supply. That is a supply curve for luxury hospital rooms. So with increase in price, you can see the number of rooms occupied, say the number of rooms that the hospital is willing to supply is also increased. That means the upward slope of the curve indicates that there is a direct relationship between price of a commodity and its quantity supplied. So that means producers will be willing to sell more only at a higher price, right? Because at the price of 4,000 rupees, the hospital is willing to provide 7 rooms. But at the price of 1,000 rupees, the hospital is willing to provide only 1 room. So one important reason for this is the law of diminishing returns. So what does it mean? It states that given all other inputs fixed, if one input is increased, the total output will also increase, but less than proportionately. So let's understand with the example. If society or people or patients want more hospital room services, okay, so what does this hospital need to do? They need to take more labor, they need to recruit more workers, right? So according to law of diminishing returns, each new worker will be adding less and less extra product. Okay, so to compensate this price, they need to increase the cost of the rooms. So by raising the price of hospital room services, society or people or patients can persuade hospital owners to produce and sell more room services. Okay, and the supply curve for rooms therefore is upward sloping. Now coming to other determinants of supply, first is the cost of production. So that is nothing but the if the cost of production is more, or if the cost of production is increasing, then the supply will decrease. So there are two factors. One is the technological advancement. That means if there is advanced technology that can decrease the cost of production, eventually the supply will increase. And similarly, the prices of inputs, for example, if the price of air conditioner in the hospital room is more, or if it is increasing, then the supply will decrease. And now coming to the second determinant, that is the prices of production substitutes. That mean, so we have luxury rooms and the general ward. So both these prices, the prices of production substitutes, in the sense the substitute for luxury room is the general ward. So the price of general ward will also determine the demand of supply. And third is the market organization. For example, if the market, if it is a monopoly, that means if there is only one hospital that is serving in a particular area, so obviously the demand will be more. And last is the government policy and the insurance. These are general factors that can affect the supply and demand. Now coming to market equilibrium. Before this, we have discussed the demand schedule and the supply schedule, right? So the market equilibrium comes at that price and quantity where the supply and demand forces are in balance. So what does it mean? To know the exact level that price and quantity will settle on, we need to depend on interaction of both demand schedule and the supply schedule. So we need to combine both the demand and the supply schedule. So let's understand this with the same example. But what we are supposed to do is we need to combine the demand schedule and the supply schedule. So the first column remains the same, that is the price. But in the next column, we need to take two, right? One should be quantity of rooms demanded by the patients or the people, and next is the quantity of rooms that the hospital is willing to supply. In the next column is the state of market, depending on the first two columns, and next is the pressure on price. So I will explain it very easily. So first look at the first price point, that is 4,000 rupees. So at the price of 4,000 rupees, the number of rooms demanded by patients is 1, but the number of rooms the hospital is willing to supply is 7. So that means supply is more, demand is less. So the state of market is surplus. And similarly, at the price point of 3,500 rupees, the quantity of rooms demanded by patients is 3, but the hospital is willing to supply 5, which is also more. So the state of market is surplus again. But at the price point of 3,000 rupees, the quantity of rooms demanded by patients is 4, and also the quantity of rooms that the hospital is willing to supply is 4. So this is a point where we can call it as the market equilibrium. So if you can see the last price point, that is 2,000 rupees, the quantity of rooms demanded by patients is 6, but the hospital is willing to supply only 2. So there is clear shortage. So the state of market in this case will be shortage. Now let's look at the pressure on price. So what happens if the demand is less and the supply is more? We need to decrease the price, right? So the pressure will be downward in the first two cases. If the state of market is surplus, we need to decrease the price. But at equilibrium, we don't need to make any change. It has to be neutral. But if you can look at the last price point, that is 2,000, where the state of market is shortage. That means demand is more, but the supply is less. Here we have the chance of increasing the price. So the pressure on price will be upward. So the same thing has been shown in this graph. If you can see, one is the demand curve and the other is the supply curve. That intersection at 3,000 rupees, okay, which is encircled. So that point is called the market equilibrium. Above it is surplus and below it is shortage. So now coming to the concept of elasticity, we all know that if price of a good increases, then people will buy it less. But how much less? So in order to measure that, we use the term elasticity. It provides a way of measuring how sensitive demand or supply is to factors such as the change in price. So first we will start with the price elasticity of demand, or PED. So price elasticity of demand allows us to predict what will happen to the spending when the price changes. So that means in the denominator, we will put the percentage change in price of the good. So we want to see the what will happen to the spending in the numerator, that is percentage change in quantity demanded, that should be the numerator, divided by percentage change in the price of the good in the denominator. So simple example, if the price of an osteopathy treatment rose by 10% and the quantity bought fell by 5%, then PED will be calculated as, in the numerator, what is the percentage change in quantity demanded? So that is quantity bought fell by 5%, that is minus 5 should be in the numerator, divided by, in the denominator. So what is the denominator? Percentage change in the price of the good. So the treatment price was increased by 10%, rose by 10%, right? So in the denominator, it has to be plus 10%. So if you calculate it, you will get minus 0.5. So, okay, we will look at the interpretation after seeing the rules, okay? Now let's look at the second example. If the price of an eye test fell by 20% and the quantity bought rose by 30%, then PED can be, in the numerator, that is nothing but the percentage change in quantity demanded. So what was the percentage change in quantity demanded? It is rose by 30%, that is plus 30% in the numerator, divided by, in the denominator, percentage change in price of the good. So what is the change in price? That is fell by 20%. So that is minus 20%. So we got a value of minus 1.5. So now let's look at the rules and then we'll try to interpret the answers. So these are some general rules. If the price elasticity of demand values lie between 0 and minus 1, we call it as price inelastic. But if the values are between minus 1 and minus infinity, we call it as price elastic. So now let's interpret the example 1. So our value is minus 0.5, right, in the example 1 of osteopathy. So that means it lies between 0 and minus 1. So we call it as price inelastic. So what does it mean? Demand for osteopathy is not particularly sensitive to changes in price. And similarly, in the second example, the answer is minus 1.5. So it lies between minus 1 and minus infinity. So we call it as price elastic. What does it mean? Demand for that eye test is sensitive to change in price. Similarly, if the price elasticity of demand is inelastic, then a rise in price will lead to people spending more, while a fall in price will lead to people spending less. And if the PED is elastic, a rise in price will lead to people spending less, while the fall in price will lead to people spending more. It is opposite to that of inelastic. Now coming to the other types of elasticity, one is the income elasticity of demand IED, which is similar to that of price elasticity of demand, but in the denominator we will take the percentage change in income. Second is a cross price elasticity of demand where we compare two commodities. So in the denominator it will be percentage change in the price of another commodity. And the third is the price elasticity of supply. So in the numerator we will be talking about percentage change in quantity supplied divided by percentage change in the price of the good. Now coming to the determinants of demand for healthcare, there are many factors which affect the demand for healthcare. So first is the price factors. Under price factors we can see transportation cost to visit the healthcare facility by the patient, waiting time to get service from the public clinic or practitioner. So sometimes the waiting time increases and the patient has to go back to their home and come back to the clinic next day. So this will increase the travel expense, right? And third is the money or cash price. So under this we can see the cultural differences in price tags. That means people belonging to a particular culture believe that the cost of healthcare treatment should be high, and the differences in payment method between qualified doctors and the local practitioners. See, qualified physicians generally prefer to take amount in a single installment, whereas the local practitioners will give the flexibility for the patients to pay it back in installments, right? And last is the unreported payments. So there is this tendency, I know some private practitioners will tell or ask the patients to visit them in their private practice, because these people sometimes they do multiple practices. They will be working in government hospital in the during the daytime, and in the evenings they can have their own private practice, right? So these all these things come under the unreported payments, where doctors might take some gifts from the patients also. Okay. Second is the patient factors. Under patient factors, we can see the health status of an individual, whether the patient is suffering from any acute disease or chronic disease. Second is demographic characteristics. The growing population has the high demand for healthcare. Also, the aging population and gender based. No, male and female have different health behavior, right? So, based on that, also the demand for healthcare will be affected. And last is economic standing. That is, if there is rise in income, that will eventually lead to the increased consumption of healthcare services. Third is physician factors, where we being patients delegate all decision making powers regarding our own health to doctors or hospitals, right? So a doctor is called a perfect agent when he or she is committed to provide the quickest possible relief at the lowest possible cost. But some physicians can serve as imperfect agents, serving their own interests over those of their patients. A simple example, if two treatments work the same, that means the outcome is same, the doctor can choose the cheaper option to save the patient money, right? But they choose the more expensive one and use the extra money to fulfill their own personal needs. Now coming to classification of cost, first is by traceability. There are two types of cost. First is direct cost, which can be traceable to a given cost object. A simple example is a blood test. Second is indirect cost, which cannot be traced to a given cost object. Examples include indirect costs of a patient care in hospitals like catering and laundry. Next is by cost behavior. First is variable cost. Variable cost change as output or volume changes in a constant proportional manner. That is, if output increased by 10%, cost should also increase by 10%. Fixed costs do not change in response to the changes in volumes. Semi-fixed or step-fixed do change with respect to changes in output, but they are not proportional. Coming to semi-variable cost, these include elements of both fixed and variable cost. And the last one is the curvilinear. A curvilinear cost, also called non-linear cost, is an expense that increases at an inconsistent rate as production volume increases. So each cost classified in the first category of direct or indirect cost can be categorized into variable, fixed or semi-fixed. And similarly, each cost classified in the second category of variable, fixed and semi-fixed will be categorized into direct or indirect cost. So that means we use a 2 into 3 matrix where all costs fall into one of the 6 cells of the matrix. So this is how the cross classification of cost behavior is done. So it is basically a 2 into 3 matrix where on the left side you can see direct and indirect cost, where in the columns you can see the variable cost, fixed cost and the semi-fixed cost. So by controllability, we can classify the costs using three approaches. So in the first approach, we consider all the 6 categories in the 2 into 3 matrix as controllable cost. Whereas in the second approach, controllable costs may be limited to costs classified as direct. Whereas in the third approach, we will limit that to the costs that are direct and variable. And by selection among alternatives, costs can be avoidable costs which can be eliminated or saved if an activity is discontinued. So they remain only if the activity continues. Second is the sunk costs, which are unavoidable costs, and these are unaffected by the decision under consideration. And next is incremental costs, and these costs represent the change in cost that will result from a specific management function. And the last is the opportunity cost, which is very important. So opportunity costs are values foregone by using a resource in a particular way instead of in its next best alternative way. So I will explain this with a very small example. Assume that a hospital is considering expanding its facility and would use land acquired 20 years ago. And they bought this land for around 1 million 20 years ago. And the current market value is 10 million. So in this case, the opportunity cost of the land is 10 million if selling the land is the next best alternative. Okay. Now coming to the next topic, that is total cost, average cost and marginal cost. To start with total cost is the sum of total fixed cost plus total variable cost. So mathematically TC, that is total cost, is equal to total fixed cost, that is TFC, plus TVC, that is total variable cost. So average total cost is equal to the total cost per unit. So it is obtained by dividing total cost by the number of units of output. So to get the average total cost, we need to divide the total cost by the number of units of output, that is Q. So TC is nothing but TFC plus TVC, right? In the first equation. So you need to substitute TFC plus TVC in place of TC divided by Q. So if you divide TFC by Q and TVC by Q, these also will turn into average. So average fixed cost plus average variable cost. So average total cost will be equal to average fixed cost plus average variable cost. So marginal cost is nothing but the increase in total cost that would result from the production of one extra unit. So always remember this. Next is cost and pricing. Any organization or any hospital, the cost of production is an important determinant of the pricing decision, and it will also determine whether the organization remains in that line of business. So a common approach to pricing is to estimate the variable cost per unit, that is AVC, and to add on a markup to cover overheads and give a satisfactory profit. So markup is nothing but the amount added to the cost of production to determine its selling price. So it covers overhead costs like rent and salaries and provides profit. So let's understand this with an example. If the variable cost is rupees 100 per unit and it has been estimated that a markup of 50% will cover fixed costs and provide a satisfactory profit. So if they are asking you to calculate the selling price, so we need to use the formula SP, that is selling price, is equal to average variable cost, that is AVC, multiplied by 1 plus M by 100. M is nothing but the percentage markup. So in the given question, the percentage markup is 50% and the average variable cost is 100. So 100 multiplied by 1 plus M, that is nothing but 50% markup divided by 100. So if you calculate, you will get the selling price as 150 rupees. So now how much should be the markup? Because in the previous question it was given directly 50%. But how to calculate that exact percentage? So for that you need to understand one concept. If the price elasticity of a demand is greater than 1 in numerical terms, the optimum percentage markup on marginal cost is given by a formula, that is 1 by EP minus 1 multiplied by 100%. So what is EP? EP is the numerical value of the price elasticity of the demand. So we have already talked about price elasticity of demand, right? PED. So EP is nothing but the numerical value of the PED, ignoring the negative sign. So let's understand this with an example. It is estimated that the price elasticity of a demand, that is PED, for the service is minus 3. Calculate the optimal markup price. So you know the formula now, that is 1 by EP minus 1 multiplied by 100%. So 1 by what is EP? So we need to ignore the negative sign. We need to take only the numerical value. So the numerical value will be 3. So 1 divided by 3 minus 1 into 100%. So if you calculate it, you will get 50%. Now coming to the last important topic, that is economic evaluation. It compares the costs and benefits of two or more alternative treatments or activities. So in economic evaluations, the costs and consequences of alternative interventions are compared to examine the best use of the state's resources. So there are some characteristics necessary for full economic evaluation. So one is a comparison of two or more alternatives is required And next is both cost and benefit of the alternatives are considered. Now let's look at the steps of cost evaluation, starting from defining the economic question and perspective of the study, determine the treatments to be evaluated, choose the study design, identify, measure and value the costs of the alternative treatments, identify, measure and value the benefits of the alternative treatments, adjust costs and benefit for differential timing, measure the incremental cost and benefits, putting the costs and benefits together and analyze the results, and last is the test the sensitivity of the results. So basically, there are five types of economic evaluation. To start with the first one, that is cost minimization analysis. So it is the simplest of all forms of economic evaluation. And in cost minimization analysis, the effect of the alternative interventions on the individual's health related quantity and quality of life are assumed to be equal. So in these studies, all other resource consequences are measured in monetary terms. So if two interventions have the same individual health effect in terms of both quantity and quality of life, then the one which can be judged as the most value for money will be the intervention which minimizes the net cost. So the assessment unit of cost is the monetary unit, and the unit for assessment of benefits is none, because we consider outcomes are assumed to be same in both interventions. A simple example: comparison of equivalent same generation, same side effect profile and same coverage spectrum antibiotics from different vendors. Now coming to the next one, that is cost effectiveness analysis. So in this type of economic evaluation, the effect of treatment is measured in a single natural health unit. So it compares an intervention to another intervention by estimating how much it costs to gain a unit of health outcome. So that unit of health outcome can be a life year gained or a death prevented. So it is used when comparison of health outcomes is helpful for health decision makers. And then it is also used when interventions of same type competing for same resources can be compared. And the unit for assessment of cost is monetary unit, and the unit for assessment of benefits is the natural health unit. That is nothing but the life year gained or the death prevented. A simple example: comparing a range of different malaria interventions when investigating the cost per case averted. Now coming to cost utility analysis, it measures health effects in terms of both quantity and quality of life. So these are combined into a single measure of health, that is nothing but the quality adjusted life years. So in this, the outcome measure incorporate both quantity and the quality of life. It also compare interventions with broad ranges of outcome and from different sectors. Also provides a common outcome measure so that different interventions can be compared. It also compared new programs with other programs that were evaluated with the same method. So the unit for assessment of cost is a monetary unit, and the unit for assessment of benefit is the quality adjusted life years. A simple example: deciding if a new vaccine or treatment should be adopted within a national health benefit package. Now coming to the cost benefit analysis, where all individual benefits are measured in monetary terms. That means all costs and consequences are measured in the same units. So this analysis is useful when there are wide range of diverse outcomes associated with the treatments being evaluated. So it makes it possible to compare programs that generate different types of outcomes within the health sector and outside the health sector. So the unit for assessment of cost is the monetary unit, and the unit for assessment of benefit is also monetary unit. A simple example: considering non-pharmaceutical interventions for COVID-19 control in terms of both health and non-health outcomes. Now coming to the last analysis or the last economic evaluation, that is the cost consequence analysis. So this is a modification of cost effective analysis. It ensures that all outcomes of importance are acknowledged. So the unit for assessment of cost is a monetary unit, and the unit for assessment of benefit is the natural unit, similar to that of cost effective analysis, but it is not restricted to a single outcome. A simple example: if the decision maker is particularly interested in the impact of a digital product on broader patient oriented outcomes such as patient well-being and satisfaction. So in this case, this cost consequence analysis will be the best economic evaluation. I hope this is helpful, and thank you.